can women unlock the secret to glowing skin and balanced hormones? In this video, I'm looking at evening primrose oil and the benefits for women. You'll learn how to spot the signs evening primrose oil is working and find out how to manage the associated risks. There's a reason why this natural oil is making waves in beauty and wellness routines for women around the world. And if you're new here, I'm Dr. Gayla Gorman, a licensed acupuncturist, naturopath, and author of What's Your Kryptonite? If you'd like to use complementary medicine, you'll need help talking to your doctor. You can get my free guide, How to Talk to Your Doctor So They Listen. Just comment guide or go to drgayla.com/links. On this channel, I'm here to help you reverse the effects of chronic stress so that you can cruise through midlife and beyond symptom-free, so that you can put an end to common midlife symptoms like chronic fatigue, insomnia, mood swings, issues with gut health, and even weight gain. Now, let's get started talking about why evening primrose oil has become a popular supplement for women's health. But before revealing these secrets behind its specific uses and effects, we need to take a closer look at what evening primrose oil actually is, how it's typically taken, and what you should know about its general safety profile. So evening primrose oil is an extract from the seeds of the evening primrose plant. It's really rich in omega-6 fatty acids like GLA. These are the really good fatty acids. And it's promoted for conditions like PMS, menopause symptoms, eczema, and rheumatoid arthritis. So how and when is it typically taken? Well, it's often taken orally as capsules, but that can be in the form of soft gels or liquid. And it's sometimes also used topically in creams or lotions. The supplement can be taken during the day or at night, and sometimes the dose is even divided and taken with meals. So I will say that this is an oil, so even though it's kind of considered an herbal, it is an oil. And if we're taking it because it's rich in these fatty acids, then it probably makes sense to take it with meals. The typical daily doses range from 2 to 6 grams, and it's often recommended to take it for up to a year. But just know that I recommend that you still rotate it. I don't recommend you take any supplements long term. And so if you've taken it for a few months, you might want to rotate off of it and then really notice if your body starts to sort of recede in some of the benefits maybe you've gotten from it, and then you'll start it back up again. It's really important to use supplements in cycles and potentially even use them from different companies so that you get a different profile in the actual underlying herbs. So evening primrose oil is generally safe for most adults when it's taken in recommended amounts. But long-term use can be risky. It can create inflammation, thrombosis, or even immunosuppression. So you really want to be careful, especially if you're on any medications, because it may interact with certain medications or even increase the risk of bleeding. So if you're on any anticoagulant sort of medication, you would probably not want to risk taking evening primrose oil. Caution is advised if you are taking any sort of medication. You'll definitely want to do your research and consult with your prescribing physician. Now that you know what evening primrose oil is and how to use it safely, let's explore why many women choose to use it. EPO, as it's often referred to, offers benefits that can boost your daily well-being. So here's how to tell if it's actually working for you. When it comes to natural solutions for women's wellness, evening primrose oil does stand out for its unique potential to support both body and mind. The supplement is believed to make a difference in overall health. Let's look for some of the ways you might notice if it's working for you. So what does it do specifically for a woman? Well, first, it's considered to be anti-inflammatory, but remember what we spoke about a moment ago, that if you use it long-term to excess, it can actually create inflammation. It's also thought to be hormone regulating. So both of these things are really beneficial for most women as we age and move through midlife. So you can see why evening primrose oil would be something we might consider. Evening primrose oil can help relieve symptoms of PMS and menopause, things like mood swings, breast pain, hot flashes, even night sweats. It can even improve skin conditions like eczema and acne. As we talked about, hormone regulation. It can support hormone balancing. We talked about reducing inflammation, and when you reduce inflammation, it can really relieve joint pain as well. You should begin seeing signs that it's working within a few weeks of consistent use. So some of the signs that evening primrose oil is working can include feeling less anxious or depressed, having more energy, experiencing less pain or discomfort, especially breast or joint pain, improved skin hydration and appearance, better sleep, and fewer mood swings. In a 2019 article from PubMed Central, it evaluated evening primrose oil, EPO's efficacy in managing women's health issues, and it really emphasizing its omega-6 fatty acids, linoleic acid, LA, and gamma-linolenic acid, GLA, and their role in alleviating conditions like we just discussed, PMS, breast pain, and menopausal symptoms. So evening primrose oil, EPO, shows promise, but the results are mixed, and benefits do require consistent use over 3 to 6 months. Remember, I told you that you need to use it for 3 months, and then I would recommend that you take a little period of time off, a week or 2 or 3 even, and kind of see where your body is at that point, and if some of the symptoms start to return, in which case then you can take it for another 3 months and see if the positive effects are continuing to accumulate. EPO significantly reduced PMS severity scores in clinical trials. The scores dropped from 53.2 to 33.6 after 3 months. So you can see that's a significant drop. And it improved cyclical breast pain, meaning, breast pain that is associated with a woman's menstrual cycle. From 61 to 97% of women experienced improvement. Some studies found no significant advantage over other placebos or treatments like vitamin D or NSAIDs. So it really did highlight the variability in individual responses. And I would say that everybody, meaning everybody, has a different response because there's a different cocktail of things going on internally, and depending on what stressors, what toxic internal stressors you have going on, that's what's going to determine whether your body is a good candidate for using EPO. And that's why I say try it for a few months. If you're not seeing any negative indications and you're starting to accumulate some positive benefits, then take a week, 2, 3 off, reevaluate, and then use it again for another 3 months and just see how it works for you long term and if the benefits seem to be accumulating. So the GLA in EPO promotes prostaglandin synthesis, which helps to regulate inflammation and the hormone sensitivity. This is how it helps with hormone regulation. So the anti-inflammatory effect really emphasizes the benefits of using EPO for PMS, mastalgia, which is the breast pain accompanying with PMS, and menopausal hot flashes. The evidence is not really clear, but it does make sense that if it's helping to regulate hormones, that it should also help with the hot flashes. So EPO is typically well tolerated at the dosage that I gave you previously, 6 to 12 grams, and I would say up to about 3 to 6 months. There may be mild side effects like nausea or GI discomfort. The long-term safety data is limited, but this is a natural remedy and, found in nature. And if you're using really high quality herbs, then you shouldn't have an issue unless you are on prescription medication. It definitely does come with risks and may interact with medications, but the specifics aren't really gone into detail much. So if you are on a prescription medication, I do not recommend you start really on any natural remedy without consulting with your prescribing physician. In a lot of cases, you're going to need to do some of the research yourself because your prescribing physician probably will not do that for you. In another article from 2018 in PubMed Central, evening primrose oil was confirmed to be a potent source of essential fatty acids that the body can't make on its own. So I thought this was really interesting because, essential fatty acids are critical for lots of body functioning. And so if you feel like you're struggling with things that are commonly considered to point to a deficiency in essential fatty acids, then EPO could definitely help. This can really create benefits that extend far beyond traditional uses for just PMS or menopause. This article emphasized the unique chemical composition and its role in supporting anti-inflammatory processes and even metabolic health. Evening primrose oil, or EPO, is exceptionally rich in this linoleic acid and the Gamma-Linolenic acid, LA and GLA, both of which are essential fatty acids vital for the formation of anti-inflammatory compounds and the maintenance of healthy tissues. By correcting the essential fatty acid deficiencies, evening primrose oil may help manage not only PMS and menopause symptoms, but also chronic inflammatory and metabolic conditions like atopic dermatitis, psoriasis, and even cardiovascular issues. Research shows that the GLA in evening primrose oil can suppress key inflammatory mediators, while its phytosterol content may support cardiovascular health by lowering LDL cholesterol and triglycerides. So we've got a good idea now what evening primrose oil does and how it's taken. But in a moment, I'll share some more risks that you'll want to keep in mind to determine whether you'll want to avoid using EPO because it could put your body under additional stress. Excessive supplementation in any form is one of the countless ways stress creates symptoms and other health issues, especially during midlife. I created a video that shows you how to eliminate symptoms naturally, so I'll make sure to link to it below this video. But make sure you hit subscribe too, because I share a lot of tips when it comes to dealing with stress that's become toxic. Relieving the nasty symptoms stress creates makes navigating through midlife a breeze. And remember, you can get the free guide, Talk to Your Doctor So They Listen. Just comment guide or go to drgala.com/link. Now let's move on to some of the most important safety considerations you need to know about evening primrose oil. As with any supplement, it's important to be aware of the potential downsides and interactions that can come with EPO. Before adding it to your routine, let's consider some important safety notes and what you should keep in mind to use it wisely. So side effects of evening primrose oil may include mild GI issues like nausea, diarrhea, even headache. And it can increase the bleeding risk or interact with certain medications. These are some of the things we've already discussed as we've moved through this video here. So it's really important that if you've got any of these certain things already kind of going on, EPO may not be the best supplement for you to try. Caution is advised if you've got any sort of bleeding disorder or even seizure. Evening primrose oil can interact with blood thinners, think warfarin, antiplatelet drugs, and certain medications for mental health, increasing the risk of bleeding or seizures. So this is not something to take lightly. It may also interact with medications for HIV, blood pressure, and cholesterol, so always consult your prescribing doctor if you're taking any prescription medication. Common side effects include mild upset stomach, nausea, diarrhea, headache, dizziness, and skin rash. It's rare, but serious risks include increased bleeding, especially for those with bleeding disorders. We've kind of discussed this, or before surgery. So this is one of the herbs that they may ask you about if you have a planned surgery, especially if it's an elective surgery, because they're going to want you to stop a lot of these kind of herbal remedies because sometimes they do make it difficult to stop bleeding in a surgery situation. And so this could definitely be an issue. There's also a higher chance of seizures in people with epilepsy or seizure disorders. And if your best efforts to live a healthy lifestyle and do all the things you've been led to think are supposed to work aren't getting the job done, you may even be feeling like you take 2 steps forward and 3 back. Remember, you can get my free guide, Talk to Your Doctor So They Listen. Just comment guide or go to drgala.com/links. And in my next video, I'll show you how to manage the toxic stress that's sabotaging your efforts. You can eliminate the symptoms that seem to be piling up in midlife naturally without medication, crazy diets, intense exercise, or any other unsustainable lifestyle hack.